Morning all. I think we'll just give people 1 or 2 more minutes to trickle in and then we'll get going.
Hi everyone, that looks great.
Wonderful. Good morning, everybody, and thank you so much for joining us. It's really exciting to see such a great turnout at this event. On behalf of the GCRO, Social Surveys Africa, and the HSRC, we're really excited to welcome you to this event, which we hope is going to be the first in a seminar series on how do we adapt. Oh, yeah, you can see me while I talk too now, bonus, on how we might adapt our approaches to collecting social data in the context of the current pandemic. It's been really wonderful to see just how much interest there's been in continuing to collect and provide to decision makers really high quality social data during this time when there's a particular need to know how things are evolving in the Southern African context, and also to see reflected the concerns about the well-being of researchers and, very importantly, research participants. And I'm really excited to have together a group of people who are committed to continuing to do this kind of work despite the difficult circumstances. We've had really great levels of interest from a really diverse range of people. We've got participants online from different parts of civil society, from government, from market research, and many, many disciplines within academia. And I'm really hopeful that through this mix, we're going to have a great opportunity to learn from each other and to share our very different experiences and the strategies that we've adopted in addressing the shared challenges that we're facing in our line of work. We're hoping to continue these seminars on a 2-weekly basis, and we'll be trying to do a bit of a thematic focus moving forwards. The next seminar is set up for Tuesday, the 28th of July, and we'll be focusing on ethics. So I hope many of you will also be able to join us for that. A big thanks to everyone who's already been in touch regarding potential presentations. And if anyone else would like to volunteer, please just drop me a note and we'll find the best place to slot you in. We are committed to making this seminar series as inclusive and respectful as possible. Please do drop me a note if you have any thoughts around how we can meet that objective. We'd love to hear thoughts. And just in general, any feedback will be very gratefully received. So please do feel to drop us a note with your thoughts. With that, I'll hand over to our speakers. We're very fortunate to have three wonderful speakers with us today. Firstly, Ms. Lebogang Shilakoe from Social Surveys Africa. We'll then have Ben Roberts from the HSRC, and finally, Mr. Molayi from Statistics South Africa. So thank you all very much, and Lebogang, over to you.
Okay. Hi, everyone. I hope you can all hear me. Let me put my video
perfectly.
on so you all get a sense of who I am. So my name is Lebo, and I head up the Field Research Department at Social Surveys Africa. Let me just share my screen. Okay. You can see it now. Okay. So yeah, as I said, my name is Lebo, and I head up the Field Research Department at Social Surveys Africa. And maybe just to start us off, I'll tell you a bit about who we are as Social Surveys. Sorry. Yeah, I'll just tell you a bit about who we are, because maybe there is some synergy between what we do and what you do, and we could collaborate in future. So, yeah, we're a social advisory organization, and we specialize in the in-depth understanding of community dynamics. So understanding the nuances that drive communities. We provide evidence-based decision-making support to policymakers and intervention implementers on social justice and social development issues across a wide range of sectors. And we do this by designing research projects that are very context sensitive and by collecting reliable primary research data. So my presentation today will be focused around our lessons in collecting this primary research data. So the lockdown has had many effects on research capabilities, but I've just pulled out a few that really stood out to us during the lockdown, even now. So there've been some barriers. There are the obvious ones like restricted movement and not being able to reach like remote areas to conduct research. We've also found that people just aren't willing to interact physically because, you know, COVID is around and everyone is scared. And there are definitely higher levels of worry than usual. And that introduces some bias to the result that you can find when you interview people. So that's something to consider when you're doing research in these times. But there are also some opportunities, you know, more people are working from home. There are some people who aren't working, so they have a bit more time to engage you. And some people just want someone to talk to. When you call, people are open to talking, as opposed to usually when they have so many other things to do. And yeah, with some of these effects considered, I'll then explore some factors that will allow one to reach their intended sample when conducting research in these times, specifically when conducting telephonic surveys. So it's quite easy to assume that if you have a good instrument and you have field researchers out there, you'll be able to collect good data and you'll be able to reach the full sample that you require. But that's not necessarily true. So we've identified 3 success factors to successfully constructing a representative sample. So that's human resources. So I'll touch on recruitment, technology and equipment, and then I'll get into talking about respondent contact databases. So for each of these, I'll get into what some of the key criteria to look out for are. But this is mostly things that we look out for, and it might be of interest to you as well. And then I'll talk about the options that are out there, and then talk about considerations to make when picking which option to go for. So in terms of field researcher selection for a project, recruitment really does matter. Just the fact that someone did well in face-to-face interviews at one point and achieved the highest sample completion on a daily basis, that doesn't necessarily mean that person is a good candidate to do telephonic interviews. So what we found is that, yes, experience does matter, because one still does need to know how to negotiate buy-in with the respondents. They should know how to engage respondents and make them interested in the research and that kind of thing. So that really does matter. But there's some subtle nuances that we tend to lose. You know, on a recent study that we did during the lockdown, we had field researchers. So we chose field researchers on the basis of how many interviews they completed on another iteration of the study that we had done face to face. And we found that some of our highest achieving people struggled, and they struggled for things that we didn't anticipate. So with the one, we found that when we listened to his audio recordings, after about 2 or 3 minutes, people just hang up. And upon considering what the factors might be, we found that like he had a very strong accent and people just didn't understand what he was saying because they were just relying on audio cues as opposed to relying on all the other social cues that are there, like reading someone's lips and reading their facial expressions and that kind of thing. So now you're just relying on audio, and if the person's accent is too heavy or they don't speak the right language, it might pose drive or like intrinsic motivation also matters. When they're on field, they have a whole lot of other field researchers around them. If they're working, they'll tend to work as well. But now alone at home with no drive and no sense of persistence, people will tend to do far less than they did on field. So I'm still not sure how to gauge that when recruiting someone, but it's something to consider. It's also important to consider the home environment that the person has. Do they have kids to look after? Is there a quiet room that they can work from? Do they have any home chores to do during the day? Just considering those things in your recruitment process is also important. So this is not a one-size-fits-all for every project, but these are some factors to consider when you're doing your recruitment. So in terms of field researcher training, the key criteria for us have been the accessibility. So accessibility of the platform that you choose to train from. If you expect them to go on a video conference, is it possible? Is it feasible? If you're doing audio or video conferencing, what are the bandwidth requirements? Does the person have good connectivity at home, or is that not the case? The amount of mobile data used, that's a big one because it has very major implications on the cost of training. Another thing would be restrictions on the number of participants you can have on that platform. Say, for example, you decide to go for a WhatsApp call for your training. Does it make sense? You want to train 15 people. It might not make sense because you can only get, 4 to 8 people if they all updated their software. And then again, in training, we consider peer-to-peer support also important. So being able to have breakaway sessions is important. So when we're considering which platform to use, that's something we factor in. And also you want to be able to monitor whether people are participating or engaging with the content that you put out. So I'll just talk about the options that are available. So there's the option of self-facilitated training. So you send out an email attachment with all your PowerPoints and whatever documents. But the problem with this, or something to consider, is that you don't really have control over how. You could also go for the option of video conferencing or webinars using Zoom, Skype, and whatever else. So there's quite a number of them. But bandwidth is usually a problem in disconnection. And you do tend to lose people during webinars, like they just get disconnected for one or the other reason. So what we found was helpful. So when we did try this out, we used Zoom, and you can get a report on Zoom that tells you the attendance statistics. So it'll tell you when a person was on the webinar and when they might have gotten disconnected. So it was possible for us to go back and give the people the recordings and be like, okay, listen to this minute until this one to catch up on what you might have missed out on. And also another thing is field researcher comfortability with the platform. Do they know how to use it? Do they know how to download it? We found that that was a problem for some of our guys, in as much as we thought they were tech tech savvy. Okay, and then audio conferencing. So that's quite similar to video conferencing. Yeah, and with audio, they might be a bit disengaged with the content because they're not seeing what you're talking about. So that might be something to consider. And then there's pre-recorded videos and audio. So with this, you need to consider the size of the videos and the audio. Can you share them? Can you share them on WhatsApp? Can you share them on email? Whatever platform that you choose to use. And you aren't really sure that they'll engage with the content in the way that you want them to engage with it. So other things that we've done are things like quizzes. So when you're training, maybe quizzes should be a norm so that you can gauge how people are understanding your content, and also having people do mock interviews during the training. So interviews with one another, so you can see how they ask questions and that kind of thing. So you know that there's some standard when your field researchers are interviewing. And then there's the option of training in smaller groups. So having groups of 4 people at a time and train them there. So that might eliminate some of the bandwidth problems, but it will be time consuming because now you're running the same training for a couple of people. So another thing to consider is also training times. And I think for this, the best thing to do is just to consider your field researcher preferences. So if they'd rather have, I don't know, like a 4-hour slot in the morning and then continue after hours, maybe at 6 p.m., continue with the training. I think you are convenient for them and their productivity. Yeah, and then piloting and also piloting of field protocols and the databases that you'll be using is also quite crucial to the success of your project and your ability to reach that sample that you want. Also consider recording all the sessions so that people can have easy reference to things that they might have missed out on. So our preferred approach for training so far has been WhatsApp training. So as I mentioned, like we've tried almost everything. And WhatsApp training has been the best platform. So how we did this was to pre-record videos and make sure that they're a size that can be shared on WhatsApp. And then between every video or every 2 videos would then send out a Google form quiz. So the nice thing about that is that it just scores for you. There's no administrative hassle of trying to score quizzes and seeing who's struggling with what. It does that for you automatically. So that's one thing to consider when you're training. We shared all the training material and asked questions based on what they had read already or had an idea about. And then we also we did this on a WhatsApp group so they could share their questions on there. So everyone got to see those questions and we'd respond to everyone at the same time. So there wouldn't be communication that isn't shared with some people and is only shared with others. And then the nice thing about WhatsApp, again, is that you can track whether people have engaged with your content or not. So those little blue ticks, you can go in and actually see who read whatever you put up. And based on that, you can go back and be like, hey, I can see you're not in training, what's going on? And just finding out why it is the person has engaged the content and making sure that they do when they can. And then also, we'd have everyone reflect on the little videos that we share. So we'd share clips of like 10 to 15 minutes. And after each one, we'd have people reflect on that. And then we'd still do sub-WhatsApp groups, so smaller WhatsApp groups for these breakaway sessions. So this has worked very successfully for us. And I think we'll continue with this method of training. Okay, then in terms of field researcher management in field, some of the key things to consider are the ability to track completion. So tracking in terms of what you've received on the server already and what the field researcher has completed so that you can see what the differences between the two are. And then checking in and signing out at the end of the day, we thought that was quite important because some people start work a bit later and that would affect how much work they can actually get done. So just having everyone sign in each morning also worked very well. Having daily debrief meetings, so that helped us support our teams with regards to the different challenges that they might have faced during the day. And then it's also important that there's very seamless information sharing amongst the team. And you also want to be able to data quality control in real time. So the software that you choose should allow for that. And another key criteria for us is being able to record the interviews, because we found that we keep coming back to quality control and back check and that kind of thing. So just having the interviews recorded and having the back check being very high level. Okay, so there are different options that are available for field researcher management while they're on field. So in terms of completion tracking, you could use Google Sheets. So we tried that, but we had a whole lot of problems with some devices not being compatible, some people not knowing how to use Excel. So yeah, we had to send out manuals on how to use it. So it wasn't very convenient. Or you could also do manual paper tracking. So we tried this as well, but there was now too much picture traffic that had to be processed. Like you completed X number of interviews and that person so many number of interviews. And yeah, it's a lot of work. It's really a lot of work. And then in terms of managing the field researchers as well, checking in the morning, we tried voice calls, but we found that by doing that, we sometimes disturbed ongoing calls with respondents. So that might not be the best thing to do. You don't have a sense of what people are doing at what time. And then for the back checking calls, as I mentioned, we found that respondents get frustrated with us calling them, because usually what we do with the back checking calls is to sit with the data set and then sit with the responses that we got for that particular respondent and then ask them a couple of questions, maybe ask them question 4, 10, and 14, just to make sure that our field researchers were capturing the data how they ought to have captured it. But people got frustrated. So now what we've been checking for is whether people, whether they called the right phone numbers that we had given to them. And we did this by calling the person, finding out if they got interviewed and if they received their incentive, if there was an incentive attached. So they were more willing to talk about that because they do want their incentive. So what we did in terms of quality control then and managing how our field researchers are capturing the data is recording the interviews. But one thing to consider there is that you do need to get consent from your respondent before you record the interview. Okay, so what we've preferred so far in terms of tracking completion, so we've been using survey solutions and it's been working well. So what we do is to get a summary of how much our field team has completed for the day, how many interviews each person completed, and which quota they've achieved for the day, and just share it on WhatsApp. And all they do is to okay it and say, yes, this is what I actually achieved or not. And then, yeah, so another thing we've been doing is because we've been getting people to record the interviews that they were doing, we made it compulsory that they share it immediately so they can delete it off of their devices so that they can create more space. Having all these interviews all on one device can result in them not being able to carry out more interviews because now their space is taken up by those. Yeah, and then we also made sure that we send out incentives to our respondents on a daily basis, just to make sure that our respondents also aren't feeling this in the study. And then we've also answered all the questions that our field teams have. And then we also, our teams, a database of contact details. On Survey Solutions, you could just put everything up there. And then our field researchers would just capture whether they tried that number and whether the callers
I think we may just have lost Lebogang for a minute. Let's just give her a moment and see if we can get her connected again.
I got disconnected. Sorry about that. I hope you can hear me.
Yes, we can hear you and we can see the screen. Can I just ask all colleagues to make sure
yeah, and then
videos are off to just preserve bandwidth? Thank you. Lebogang, are you speaking?
So we said
Lebogang, do you maybe want to try turning your screen sharing off?
Can you hear me?
And now
Hello?
we can.
I keep getting disconnected, so maybe I'll just talk without the screen share. That I hope that will be better. So yeah, in terms of
try.
Okay, all right. In terms of technology and equipment, so we found that some of the things to consider are the space on the device, your mobile data costs, the amount of data that gets used by different platforms that you choose to use, and then the device compatibility with the softwares that you choose, and also consider the amount of administration that there might be on reimbursement of field researchers or the sending out of incentives. So I think I got disconnected again.
No, we can hear you.
Okay, so in terms of technology and equipment, so there are a number of options available. So one could either use devices that are owned by the company, and with those, you do have some control over the specifications and the space that is available. But if people can't come to the office to pick up tablets, then that probably doesn't make sense. So they need to use their own devices. So understanding what devices people have, if they have backup devices as well, might also be important to consider. Also understanding which cell phone networks work in the areas that your field researchers live in. Does it make sense to have them all on one network, which would be great because now you can negotiate pricing with the service provider, and you do have some control over how much data each person uses, and you have some control over the costs themselves. Whereas when people are now on different networks, yes, the connectivity might be better in some areas for a lot of people, but you don't have so much control over the pricing. And also understanding which incentives speak to your respondent is important. You could offer gift cards, you could offer airtime. So for airtime, we found that using Smart Load is great because you get airtime discounts and you can send out the data in bulk. Yeah, and also another thing, so your incentives don't necessarily have to be monetary. It does happen at times that people are so important in the research question that you have that it's an incentive enough to participate because they're so invested in that particular topic. So understanding your respondent is also important, that you're not just offering incentives when it's not really necessary. Another thing to consider is whether your field researchers have more than one device and which software you're using. So are you using a software that can both do data capturing and recording of voice calls? And if you're using one device for both those things, how easy is it to go between one software to the other? And could it potentially result in the device crashing? And if it does crash, is there a backup? So I know platforms, apps like Survey CTO, I think you can do both those. So capturing of data and recording of calls, you can do that on Survey CTO, if I'm not mistaken. But there are also other options available. So you also need to understand what functionalities you require for your particular study. I know with platforms like RedCap, I think it's by the University of Stellenbosch, if I'm not mistaken. I think I might be. With that, you can do follow-up interviews with the same person using that software. So it'll even tell you when to interview which person. So you can have like a triggered survey. You can have you can do longitudinal studies through that, because it does tell you when it's like time to interview that participant. Yeah, so some criteria to, okay, so now I'll move on to the respondent databases. So the criteria to consider for this include things like the biases that are introduced by that particular database. So if you're going to be using a voters roll database, for example, to understand things about corruption, that might not be the best way to go, because you might find that some people who do have something to say about corruption chose not to vote because they didn't think that the leaders we have are trustworthy or something like that. So just understanding what research question you have to answer and the biases that are introduced by the database that you're using is quite important. Also, the size of the database, how big is this database and how big is your sample? And understanding again how likely it is you will find the people who are on your database, like when last was it updated. Another thing to consider there is the degree of randomness of the database, like how was the database compiled? How did you find these people? And does this meet the standards of this particular study that you want to do? Another thing to consider would be ethics and POPI regulations, to have people consented to you using their contact details, for example. Yeah, and then with these databases, you do find that they get used over and over again. So there might be some interview fatigue, or people just tired of their numbers being called for a whole load of things. And also, one should also consider the cost of getting that database or even compiling that database themselves. So I'll talk a bit about how to go about compiling your own database or expanding your database as well. So yeah, one just needs to understand what sample distribution they desire in their particular study. Like, are you looking for people in a certain place? Are you looking for people of a certain gender, of like, I don't know, a diverse socioeconomic standing? Just consider all those things and see if your database does speak to that. So in terms of databases that are available, I think here I've listed about 6, and I'll send out, I'll share these slides with the organizers so you can share them with everyone, so you don't need to take notes. I think they're quite self-explanatory. So in terms of the options available for databases, one can have like existing project-related databases, but these can introduce a desirability bias. So if, for example, you want to find out about the effects of a project, and now you're asking the beneficiaries, that might not be the best way to go about doing that, because it does introduce some bias there. And then you do find some incentivized apps that people sign up onto, and you can put up ads on there. So there's apps like the Moya app, which pretty much works like WhatsApp. And I think there's about 1 million people on there. So if you put up an ad on there, people will see your ad, and then you can just click and complete your survey. And there are others like M4Jam. And I think with them, they actually pay you for participating. So with these types of incentivized apps, you might find that people are interview fatigued. And you could also find, so one thing we found from using the Moya app is that people are just chasing the incentives after a while. So you'll find the same person entering a whole lot of submissions. And the thing is, you pay for every click that they make. So now you paid for every single submission that they've made on there. So it might not be worthwhile. So also considering the cost implications there and the chances that there might be duplicates in your data set. And then there are other databases like the voters roll database or credit bureau data. But with using these, just consider the ethics of using that data and also how representative it is to the sample that you desire. And then you also find all these digital telephone directories. and business directories. So with those, just consider the type of people who would be using landlines, and also how representative that is for your sample. Another option that one does have as well is social media adverts. So you could put out an ad on Twitter or Facebook or whichever other social media platform. But with those, like, your marketing strategy has to be on point. Like your ad has to be eye-catching so people actually are interested in participating. But with this, you also introduce that incentive chasing story where people are just clicking because you said there's an incentive. And then another thing to consider is using or like calling up participants from past projects. But with doing that, just understand that everyone should have consented to being recontacted. And if you're going to keep using that database over and over again, interview fatigue again. So if you do have a database, for example, and you find that it's too small, or you find that you aren't reaching the numbers that you need. So another something that has worked very well for us recently has been snowballing. So from the people that we've been able to find, snowballing for other people. So with this, you really, really need to be very purposive in how you snowball. So you need to be clear on who you're looking for. You need to be clear on how many people can actually have relationships with each other. So is it acceptable that 10 people within your sample know each other and are probably friends? Does that make sense? So just making that very clear that as you snowball, you don't get the same type of person and your data is representative. And also keeping your finger on the pulse when it comes to the gender and socioeconomic standing and that kind of thing as part of your survey. So just make sure that you do have questions that pull that out, that do ask who people are, so you can know if you did meet your sample specifications. And then there are other things that you can do in terms, but these are all face-to-face methods for improving your sample. So say, for example, or even getting a database together for starting with. So you can do house-to-house contact detail harvesting. So with that, say, for example, you want to do a census, for example. What you could do is to draw out a random sample of dwellings and say which individual within the household you want to speak to, and have field researchers just go in and ask for the contact details, not even going into the household, just by the gate. Ask for the contact details, send them to the team in the office, and tell the respondent that someone will call them in the next 5 minutes. So that might be a strategy that could work. And then you also have the option of in-street contact detail harvesting. So this could be either at a mall or at a street corner or at a taxi rank, where you have field researchers go around and find someone to talk to, find people who might be interested in participating in the study. And then there's also in-transit contact detail harvesting. So say, for example, you're interested in the views of people who use taxis to get from Randburg to some other place. You could actually have your field researchers sit in a taxi and get those contact details while traveling to and from the place where, through the routes that you're interested in. And then you also have the option of workplace contact detail harvesting, which would be, say, for example, you're interested in the views or the effects of the coronavirus on people who work in factories, for example. So you could actually go to a factory plant and harvest these contact details and have your field researchers sit and conduct these interviews telephonically from wherever they are. So with a sample, with a contact database that's good enough, and incentives for participating that actually speak to your respondents, self-completion surveys could be the way to go. So yeah, so this is the end. Thank you so much for listening, and I hope I didn't go beyond the amount of time that you had for me. If there
Wonderful.
are any questions or comments or any strategies that you've adapted, then you can talk about this now.
Great. Thank you so much, Lebogang. That was absolutely fascinating. And I really want to thank you for kicking off this seminar with such an open and generous approach to sharing all your learnings, which I'm sure have been hard-earned. I really, really appreciate it. So we are a little tight on time. Melinda's just helpfully put up a slide for us of various questions that have come through. Maybe you could just take a few minutes to speak to a couple of them. There were a few questions on the pre-recorded video and audio sign and check in. How are people responding to respondents and consent? And then a few questions around incentives. Maybe you could just pick a few to speak to, and maybe we could just send a few notes after the seminar on those that you're not able to speak to.
So I see a question on the Google form quizzes. So that's a function that's built in already. You just need to assign points to every question, then it just marks it for you. Then in terms of how we pre-record videos and audio, how that works, I think I might have touched on that. So on PowerPoint, you can just record on there. So if you go to view, I think, you should find an option for recording. So you don't even need to get an add-on or like an app to do that. And then in terms of how the field researchers sign in and check out, so that's just on WhatsApp. So they'll just say, I'm ready for work and I'm starting now. And we'll know that we should expect some interviews or some movement on Survey Solutions in terms of them saying that I've tried this number versus I haven't tried that number. So we can triangulate whether they are actually working. How field research is received by respondents. So we actually found that on level 5, like more people were more willing to talk. And I think it's because people weren't moving around too much. So people are really willing to talk. But now I think people are a bit busier, but yeah, the turnaround in terms of the numbers that we're reaching telephonically aren't too bad. Like they're not bad at all. And I think it has something to do with how the field researchers negotiate buy-in with the respondent. How is consent handled? So we had the field researchers read the consent form to the respondent, and then they would say if they're willing to participate or not. So this was all read out to them. And we'd also share it with them on WhatsApp, if they do have WhatsApp. Yes, so we do use Survey Solutions. Yes, that's exactly what we use. And then the sort of incentives that we use so far. So far we've used airtime as an incentive. So airtime or data, which we sent out using Smart Load. It's very easy. You just send it out in bulk. You just need to make sure that you're getting people's phone numbers and you are getting, which network that they're on. So those are the 2 variables that you need to make that work. How do you ensure representative samples for your surveys? So I think that really depends on the type of study that you're doing and the type of people that you want there and what's acceptable for you. So on most of the studies that we do, like we want a fair distribution of male and female and income levels and that kind of thing. So I think it really depends on the type of study that you're doing and the type of question that you're trying to answer. How do you know when to offer incentives versus when not to offer incentives? So I think a lot of times we've just gone by whether we have the financial means on the project to be able to send out these incentives. But with things that are like of public interest, say for example, corruption, people want to talk about corruption, especially at a time like this. So maybe an incentive isn't the way to go. So maybe you could try it out without an incentive and then later on go on to use an incentive and see if there's a difference between the number of people that you do find. Okay, how would you go about developing a database when you're switching from community field? Okay, I can't see the rest of the question. I'm a bit lost. I'm not sure where I was. How do you go about developing a database when you're switching from community field research to telephonic research? Also, does this affect representativity? I can just respond to all these questions in the chat so that we don't go over time, which we might have already. I think we've gone over. So I'll just respond to all the questions in the chat.
I think that would be absolutely fantastic, Lebogang. I really appreciate your engaging with all these questions as well. And I think a number of the themes that are coming up are definitely things that we'll hear more about in subsequent presentations as well, and perhaps also subsequent seminars. If you want to also just write up any responses, we can certainly circulate that along with the presentation to participants. So thank you so much, Lebogang. This has been such a fantastic presentation, and you've given us, I think, all so many great insights and thoughts. Really appreciated it. So with that, we're going to hand over to Ben Roberts from the HSRC. Ben, do you want to try with screen sharing, and then if that doesn't work, we'll also just switch to voice.
Okay, great. I'll try now, Julie.
Thanks so much.
Is it displaying on your side?
Yes, perfectly.
Great, thanks. Morning, everyone. My name's Ben Roberts. I am the coordinator of the South African Social Attitude Survey series at the Human Sciences Research Council, based in the Developmental Capable and Ethical State Research Program. In the presentation today, I'll sort of building on some of the themes that Lebogang talked to, and certainly some that Solly will speak to after me. I'll just talk to some of the key features of the HSRC SASAS response in the lead up and during the COVID-19 pandemic, and talk about sort of possible ways forward. But I think really, by way of starting, it's really about reflecting on the great disruption. I think there have been sort of many uncertainties that we face right now in the survey environment, and the relative impacts that it's having. It's unfolding not only in South Africa, but across a range of countries and subnationally in very varied ways. And so really, I think what I'm excited about with this particular webinar and the subsequent ones is really starting a conversation and trying to build communication between practitioners in the field and try and work out the kind of strategies we might want to start employing, talking about a community of practice and shared insights and experiences to really start mapping out a relative way forward. For those of you that are not familiar with our survey series,
Hi, Ben. Sorry to cut in, but a few of us are struggling a little with hearing. If you could just maybe try to speak up a little.
Is it speak up or just cut this video?
I think just speaking up.
Okay, sure. So the survey series was established in 2003 as a tool to monitor underlying social and political value change in the country. It is at the time of the national lockdown in late March, we were actually busy with our 17th annual round of the survey series. So I'll come back to that in a minute in the kind of lead up to the lockdown and the kind of challenges that it threw up to us as you know, in terms of the infrastructure because of that. The survey series drew on the relative experience of some of the longest standing social attitude surveys, including the American General Social Survey from the early 70s onwards, the British Social Attitude Survey from the early 80s onwards, and the German Albus Survey, which was also established in the early 80s. With the survey infrastructure, we're trying to measure and produce rigorous data about changes in public attitudes and underlying behavioral patterns over the long durée, over a long period of time. We're also trying to achieve recognition and produce reliable social indicators of national progress based fundamentally on the attitudes and judgments of citizens, alongside the kind of more so-called objective indicators that SASAS attempts to generate. And to date, the survey has received recognition for its contribution of high-quality data for policy-oriented social science. Very, very briefly, this, in terms of, it is nationally representative probability survey, 16 years and older, focused on those living in private residence. The response rate, we start off with a draw of 3,500 addresses per questionnaire version. We typically field 2 to 3 questionnaire versions with each iteration. With a minimum realization rate of 70%, we normally achieve in the 75–80% range. We don't allow substitution, and we benchmark our data to the latest available mid-year population estimates produced by SASAS. We do adhere to face-to-face interviewing, and that's been the case since, for the better part of the last 2 decades. The only change that we did do is we made the transition from PAPI to CAPI in about two years ago. The ethical protocols we adhere to are obviously very strict. We draw on the expertise of the HSRC's Research Ethics Committee, and all protocols and instrumentation is thoroughly reviewed for approval. Similar to some of the kind of points that Lebogang touched on, we adhere to the kind of quality control measures that she referred to, from monitoring the training and the quality of our staffing, recruits, through to back checking and so on through various means. The data is made freely available through the HSRC data portal. And I think a point that's had a real bearing on the sort of current period, we've always had a very strong emphasis on cross-national collaboration to really promote a deeper understanding of South African society. With those collaborations, whether it be with the European Social Survey research infrastructure or with the International Social Survey Program, it comes with very clear guidelines on what you can and can't do from a methodological standpoint. So in terms of dealing with the sort of shutdown of our fieldwork with the national lockdown and what we're thinking about for the future, really we have to bear that in mind, because it does have a real effect on our cross-national partnerships. So I just want to touch on what happened in the lead up to the lockdown and some of the field experiences that we had, and it was actually surprising about the sort of similarities in perspective compared to what Lebogang touched on. So we began our field round in late Feb 2020. Obviously, we know that on the 5th of March, we had the first confirmed COVID-19 case. This led us to adopt a range of new safety protocols, ranging from PPE to what happens in terms of the process of interviewers checking in for the morning, the kind of safety protocols and checks they need to go through, keeping details for contact tracing purposes. So a whole range of protocols we had to develop going back to the very early March period. We also had conversations with SASAS to just check to see if we're in line on certain of those protocols to get a sense of, are there other additional protocols we might want to consider. We also had daily executive meetings to review not only the national case numbers, but also the provincial case numbers, and try and get as localized an information as we could on that in order to help shape decisions whether to continue with field processes or to suspend the field round. We managed to get about 40% of the way through our round by the time we had to eventually suspend fieldwork on the 24th of March. At that stage, there were just over 550 cases nationwide. I think the area of correspondence with what Lebogang touched on was the response rates. We were actually getting far better than usual response rates in urban areas, particularly the metros. People had started working from home to some degree during the course of March. We also found that they had more time to engage with us. They actually wanted to talk, and particularly on some of the themes which we covered. Where we actually had real stumbling blocks was the increasing restrictions being made on mobility and the police concern over having field team presence in local communities. So we ended up having to, part of our daily routine is actually engaging with station commanders and actually engaging with them about the feasibility of continuing. But certainly despite that, the reality was the response rates were pretty good. in terms of the decision to close down on the 24th, we had to constantly weigh up the sort of risks, and some of the risks obviously fundamentally to the risks to our interviewers as well as to our participants. There was also the concerns that came from a range of our funders about the potential. I think there was a real panic about the potential for infection occurrence and spread through our teams, and what that would have a bearing on the reputation of those funders. So that there were regular dialogues with our funders, and not only to them, but it was also the internal reputation to the HSRC as an institution. So those were really weighed up regularly, and that's had to be our guiding principles, but fundamentally to the interviewers and our participants. During the lockdown period itself, I think one of the more distressing experiences was obviously our field staff, reporting severe duress themselves. Their income streams being cut off. So there's a constant appeal for how can we support our field teams during this period of relative shutdown on our field processes. So we had to have constant dialogue and WhatsApp audio recordings and engagements with provincial teams, with individual interviewers. A lot of them were actually appealing for resumption, particularly in provincial contexts where there were relatively low case numbers at the time. So the Mpumalangas, the Northern Capes were saying, please, can we continue? And we had to go into a long explanation with a Q&A session explaining why we absolutely shut down simultaneously nationally. That was a sort of group decision in order to preserve comparability across the data series. The external funders, also we've had to go through long engagements with them about renegotiating contract periods. So we've been quite busy with that over the last couple of months, because many of our funders were expecting their deliverables in sort of the July through September period. So we're in the process of renegotiating that. Most have been very accepting of these, of these exceptional times. Some have actually asked, and I think those of us working in this field of research cringe a little bit at this, but they have asked for, give us the results of the 40% you've collected. So we haven't relented on that, although they are unweighted results that, we've been very clear that this gives a sense of an indication of tendency rather than anything definitive. But that's at least giving them some sense of what direction were the results going in, and based on that data collection. So what? We have suspended, obviously, our face-to-face interviewing processes. So the HSRC has had to adapt in various ways. The one activity that the SASAS team's been involved with is a partnership with the University of Johannesburg Centre for Social Change. We've administered what's called the COVID-19 Democracy Survey. We did our first round of this survey between 13th of April and the second week of May. And about a week ago, we started our second round of surveying. Lebogang mentioned the pros and cons of using a platform such as Molayi Messenger. That is what we're using. It is obviously a convenient sample, and because of this non-probability element to it, with respondents opting in, it does raise fundamental questions about the representativeness of the data, issues about potential bias that might emerge due to undercoverage and non-response. With our data, we did as best we could. We benchmarked it to SASA's population estimates, and we're very clear that we could draw broad inferences, but there are questions about the extent to which you can generalize these findings to the entire South African population. I know that SASA, and I think Solly will probably talk about this, but SASA is undertaking its own similar online surveying during this time, and so I think there's quite a lot of resonance there. Not me and my team directly, but other parts of the HSRC, particularly the public health groups, are focused especially on doing COVID-19 health surveys, again using the Molayi Messenger, and other units in the program have been focusing on specific subpopulations, such as focusing on the needs and impacts on youth in the country. So both of these surveys have been online on Molayi Messenger, and they are still live. The conceptual overview, so really what we were trying to do as a rapid response to, and give some sense of tendency again, was looking at the varied experiences under lockdown that South Africans have had, from issues such as adoption of precautionary measures, their perspectives on lockdown regulations, issues of compliance, experiences of such as hunger, service delivery problems, etc., and also the nature of experiences with police and army. Also looking at the psychosocial and economic impacts of that lockdown has had as well. We also have covered issues such as institutional trust, looking particularly at views on the president, police, army, traditional leaders, local councillors, and so on, as well as interpersonal social trust and linking that to social solidarity during this time. We've looked at the extent to which these things, as well as broader background factors, shape both policy support and opposition, as well as general future outlook in terms of COVID-19, specifically support for lockdown extension, risks to children and future risk in terms of personal risk of infection and those around you, and also views on the economic impact. So we've touched on a range of things that speak to the relative disciplinary competencies of the UJ HSRC team on that. I want to just deviate a little bit and just speak to what we've done relative to what some of the other big global and regional studies had to undertake in this time. And I'll speak to two cross-national, or three cross-national ones. First, the World Values Survey was in field when the lockdown occurred. What they're choosing to do is release data from the 78 countries that they have collected data on at the end of this month. 5 are from Africa. Unfortunately, not South Africa included. I think the only Southern African country was Zimbabwe. They have also chosen to postpone their face-to-face fieldwork and extend the completion period until the end of July 2021, when they'll release their second round of the data set. They're also embarking on a 3-wave panel study entitled Values in a Crisis. They're focusing first and foremost on the UK and Germany, but there's an open invitation to participate in that. They're planning to do 2,000 respondents, interview 2,000 respondents per wave, really to look at now when we're in the thick of the impact of the pandemic. Second wave towards the tail end as kind of the end is in sight period, and then I think a year in they'll look at what is the sort of post hoc effect of the pandemic on those participants. The Pew survey, particularly the global attitude surveys that it runs, they've suspended most of their international survey work, again, because most of their surveys around the globe are still done on administered in a face-to-face basis. Their data collection has placed interviews and participants at high risk, so they again were worried about that risk of spread and risk of exposure. The polling in countries where surveys, however, are conducted telephonically have managed to continue. And in the US case, they actually they work on purely on a panel basis now. So they have managed to conduct their surveying primarily online in the US context. One of our partners is the European Social Survey, which was established in the early 2000s. Round 10 was due to start in September. Again, they focus fundamentally on face-to-face data collection. Due to the COVID-19 impact, their core scientific team agreed the country should start fieldwork round about the 1st of March next year, or as close to that as possible. So in other words, around about a 6-month delay on average. They're allowing for greater flexibility in the fieldwork period relative to usual, so they're allowing for a 1-year startup period, but they are quite insistent on the finalization by the end of December in order to maintain comparability across the 30-odd nations which are participating. There is nonetheless real concern that COVID-19 may have a substantive effect on response rates and also on the face-to-face capacity across countries. And so that's still the great uncertainty which they're waiting to see. And it's led to an honest discussion about and the fundamental need to begin to develop alternative methods for the future. Also, what they've done is they've actually had an open call in the last month or 6 weeks for proposals on 10 specific coronavirus-related questions or their round 10. Those have been adjudicated and now awarded. One is dealing with legitimacy and institutional trust. The other one is dealing with the whole issue about misinformation and conspiracy theories during the time of COVID-19. So those are two specific themes that they've now prioritized that will be fielded with the round, and that they're inviting others to consider fielding as well. Moving back more locally and looking at some of the other research infrastructures beyond SASAS at the HSRC, I'm going to touch on two. One is the Coronavirus Rapid Mobile Survey. This is a nationally representative panel survey of 7,000 individuals, and each wave will be conducted on a monthly basis, drawing particularly on a subsample of the Saldrus National Income Dynamics Survey. So 5 waves are planned, running from May to October. Wave 1, the results will be officially launched tomorrow with a webinar and a series of papers being released. Like the case that was referred to earlier, they are using incentives. They're giving airtime vouchers to the value of 20 rand per individual per wave. And their real aim is to look at nationally representative data on key outcomes, such as employment, income, hunger, and access to grants. So that's been their fundamental response. And I think one of the inherent benefits of the CRAM approach is it really draws on a pre-existing panel series that was recently refreshed. It has, really a good prospect of being one of the better, more representative coronavirus-related studies that are being undertaken. The other one relates to our demographic surveillance site system, the South African Population Research Infrastructure Network. So they've developed a clear surveillance protocol since March. Their research involves telephonic interviews to screen for COVID symptoms among about 60,000 rural households in 3 of the core provinces where there are DSSs. They're also looking particularly at the impact of COVID-19 over time and also the impact of certain lockdown policies. Also, what they've done is they've recently added 2 new demographic surveillance site nodes in Gauteng and Western Cape, and really to ramp up their ability to do this kind of monitoring. So the big infrastructures are really trying to innovate as much as they can in this period. Moving back to how do we get beyond the current situation and the great disruption, the HSRC has issued an advisory on fieldwork activities. It was issued particularly in the context of the move to lockdown 3. They've allowed for the resumption of previously approved clinical trials. They're also allowing for observational studies with no direct human contact to proceed. Other studies, such as our attitude survey involving human contact, however, must be determined on a case-by-case basis with a reapplication to the Research Ethics Committee. But the reality is that it's unlikely to resume prior to lockdown level 2. And this has resonance with the research industry perspective. So the South African Marketing Research Association has said that face-to-face interviews can only commence from level 2 of lockdown onwards, and that they recommend the prioritization of online and CATI research methodologies in this space. They're also making an appeal for building a community of practice to constantly share lessons and experiences. I think the kind of endeavor which we're starting here today is very much within that line and that particular recommendation. Just one thing to say from our own perspective again is, even before lockdown, so as of late last year, we've been talking about a planned SASAS pilot panel, building on the back of a national face-to-face survey such as SASAS. Our intention was actually to use our future round, probably it was going to be the one that we were going to do at the end of this year or next year, to use that as a sampling frame to recruit after, from our participants. The recruitment to contact strategy, so the SASAS interview would serve as a recruitment interview for the panel, and that the contact information would generate telephone numbers, email addresses, etc. We actually did an experiment of this type in 2017 just to see what kind of level of support would have for the panel recruitment, and we actually found that off the back of our survey, 38% agreed to be part of the panel, around just over 2,500 participants from that particular survey round. So this is something that we are seriously thinking. We should have got Retrospectively, it would have been great to have had this operational by the time we had the lockdown, but it's really framed our thinking about next steps. So coming through to a conclusion, the HSRC will resume field work, and particularly SASAS, when it's considered safe to do so and under strict safety guidelines. They're very specifically reviewed and by the REC. So we have to submit all our new research plans to them for approval. The real intention is to start up fieldwork in all provinces simultaneously to avoid context effects and to maximize comparability as far as possible. In terms of opportunities, given that we got 40% through our data collection, there is some element of an inherent experiment that we have that comparing pre and post lockdown data may allow us to test for, to some degree, the extent and nature of a COVID-19 effect in attitudes and behavior. And we actually had, we think about the specialized modules that with our external funders who are looking at financial literacy. We're looking at, we had a detailed module on attitudes towards the defense force. So all these kind of modules that we've kind of got resonate very strongly with the kind of lockdown experiences South Africans have had. So understanding the pre and post context with the data that we've got is something that we're quite keen to look at quite closely. And I think also, really, I think that the situation has prompted the need for an earnest discussion about multi-mode approaches, and also about high-quality online survey panels recruited on the back of existing national surveys. So thank you. I'll leave it at that.
Thanks so much, Ben, for sharing all of that additional insight and content, and it's really helpful to have a bit of the broader landscape fleshed out as well. We've just got a couple of minutes before we need to hand over to Solly. Melinda's popped up a few questions from the Q&A as well. I don't know if you'd like to respond to a couple of them, and then perhaps we could just follow up with responses over email.
Okay, yeah, so I'll go through those. So the first one is from Kathy, who talks about diversity training. So it is built into our training. I understand that there are issues about trained. We've even done quite a lot of work about LGBTQ and, you know, partnering with the other foundation and others to really examine patterns around that. So we've had to quite regularly and routinely include gender training as part of our annual training protocols. So it is there. I understand that you're worried about perhaps this conflation, but we do try and address it as best we can. Let's just see, how do you think increased response rates impact on comparability of data over time? So Julia, I think I might have to engage with that afterwards because I'm not quite sure what aspect of the response rate you're talking about. Are you talking about our high response rates generally? I think it's,
yes.
I think largely it's just the contact protocols that we have. We spend a lot of time going into communities up front, speaking to local authorities. So pre-notification is key. Notifying police, going to the police station and informing them we're going to be working in the area, speaking to councillors, speaking to community representatives. Also, we spend quite a bit of time before any interviews are started, just going around and trying to engage selected visiting points and explain in detail the purpose of the study. So we've managed to maintain relatively good response rates. It is getting trickier, particularly in the metros. So we are monitoring that very carefully. And I think like many surveys out there, the gated community phenomenon is becoming more and more tricky. The issue that Lebogang touched on about respondent fatigue, the perennial challenge as well. We were a nation that's been really surveyed to death over the last 25, 26 years. So we are seeing fatigue, an element of fatigue creeping in.
So Ben, I think I'm just going to have to jump
and I'll
in
respond
there.
I'll respond online to some of the other queries.
That would be really fantastic. There's another question just popped in the chat box as well. And thank you, Melinda, for collating all the questions for us. It's super helpful. Thank you very much, Ben. And Sally, over to you.
Morning. Let me try and share my presentation.
Looks good.
Okay, thank you. Morning. My name is Molayi from SASAS under the Social Statistics Unit. Today, what I'm going to do is just to share some thoughts on the immediate and long-term impact of COVID-19 on SASAS household survey program. I will go through the background just to give the context in terms of what we do as a SASAS organization, and also the issues around. I'll talk about the suspension of our data collection, and I will touch on the interim statistical products that we've introduced, and I'll spend a little bit of time talking about us moving to a more flexible mode of data collection and what are the key implications of moving to this flexible mode of data collection. So SASAS statistical output rely heavily on the regular household-based surveys. Here we are talking about our quarterly labor force surveys, and we have what we call it a continuous data collection, which is the surveys, the annual surveys that we are collecting on an annual. These are the 3 surveys that we're collecting on an annual basis. And we do conduct the user-paid surveys. These are the surveys that we conduct on behalf of other departments. Currently, we just done the survey for Department of Transport and then the National Household Travel Survey. We do also what we call it the ad hoc surveys, your demographic household surveys. And obviously, we are also conducting the census, which comes every 10 years. Our mandate is to provide relevant and reliable and timeless, accurate and quality statistics. SASAS as a national office has, however, not been exempted from this massive disruption caused by COVID-19. As it's continuing to spread across the country and globally. What it has done, it has disturbed our operation and planning. It is also challenging our standard data collection method. In this case, I'm referring to our face-to-face methodology. It's even affected the production of the data, and also have pushed us to review our statistical value chain and beyond this year. Okay. These are our surveys that we are conducting. The quarterly labor force survey, which is a quarterly survey, and the general household survey, the domestic tourism survey, which look at the traveling patterns. Then we do have another survey that looks at measures the victims of crime, and also perception around crime and justice, which is the governance, public safety and justice survey. The National Household Travel Survey, the survey that I just mentioned earlier, is the ad hoc survey that we have conducted on behalf of the Department of Transport. It also looked at in-depth traveling patterns of South Africans. And we do have a community survey. This is the survey that we conduct in between the census. Then the last bigger survey that we are conducting is the census. The pandemic, here I'm just going to take into, I'm just going to look at the suspension of the data collection and also give insight in terms of the impact of the pandemic and also the lockdown regulation. It has a very far-reaching implication for our social and labor surveys. For example, for GHS and DTS, data collection was suspended. in March 2020. So these two surveys, they started their collection in January, and 2 months down the line, we had to stop the data collection because of the lockdown. The next survey, it was supposed to, with the JPSJS, was supposed to start in March, but we couldn't start in March because of, at that time, it was already the implementation of the lockdown. The National Household Travel Survey, one of the survey also was affected by the lockdown. We have to trim the data collection. It was supposed to run January and March 2020, with the last week of March be what we call it a mop-up period. But unfortunately, we had to suspend that activity because of the implementation of the national lockdown. All the face-to-face data collection is presently suspended, and it is not clear when and face-to-face data collection could start again, and what condition will impose to facilitate this. I think this talks to what Rob was talking about, in terms of moving to a face-to-face collection in the near future. The lockdown, it didn't only affect the data collection from our side. It also had an impact in terms of the delay in us releasing our official statistics. And it's still impacting on it even currently because of we have to revise our schedule even twice. And this is because of, if you recall in the news, we have already indicated this, that our head office has to be closed because of the continuous COVID-19 cases, where our staff are constantly testing positive. And the building has to be closed because it has to go through the deep cleaning and doing the sanitation. So these are the revised dates for the affected social surveys. For example, let me make an example. General household survey, it was supposed to be released around July. Now we have to move it to August because of the issues around the closing of the building. In the interim, because of the suspension of the data collection and also the issue around us in terms of the publications, the delay in releasing the data, we introduced what the interim statistical product. In this case, we had the online surveys just to gauge the impact of the pandemic on the household. My colleagues from the economic side, they've also done the same, where they also have introduced the online surveys just to gauge the impact of the pandemic from the business point of view. The 3 waves were already conducted. April, that was the first one in April, then the second one was the 4th, and then the third one was done around the 17th of June 2020. So you could see that with this interim survey, we managed to do 3 waves within 3 months. So it tells you a lot in terms of the turnaround time in terms of this survey. However, these online surveys use a non-probability sampling, meaning these are the convenience sample. Respondents choose to respond to these surveys and are not representative of the entire South African population. So this is some of the challenges when it comes to the online surveys, and their results cannot be generalized to the entire South African population. Now, moving to a more flexible mode of data collection, the present crisis has highlighted the need as a statistic to adapt to a new data collection methods and processes, and also try to expand our data collection modes to ensure that there's a continuity of our household-based service program in the organization. But what are the key implications to this? So what I'm going to share here is some of the short-term, medium activities as an organization that we have already started to embark on. And these are some of the things that we need to implement in this financial year. Firstly, the revised enumeration of 2020 surveys, where we're moving all our surveys to telephone interviewing. The QLFS survey is one survey that's already have started collecting using this method. We have to revise our questionnaire. Remember, our method of collection is the face-to-face. Therefore, we have to shorten our questionnaire to suit this data collection method. And changes into this may lead to a breaking in series. I mean, GHS has been collected since 2002. So there's a series of data series that we have collected over the years. And now with us moving to a new way of collection, data collection, there's that possibility that there may be a break-in series. What we also have done is that we've went back and used the previous sample files to look at the contact details from the previous samples and to create a frame for telephone interview of respondent. We also have to adjust our quality assurance mechanism and tools. Because our quality assurance was geared towards the face-to-face collection. Now with the remote data collection, we have to change and adapt our quality assurance to make sure that we still are able to produce quality statistics. Reviewing of training and publicity approach, I think Lebogang already mentioned this in terms of now with the training approach, unlike before where you're having a national training where everybody will come to a room and then you conduct your training, now you have to do it remotely. There's different ways of doing it, and I think Lebo have already mentioned some of these plans. So we are also doing that now, and we have to adjust our approach and our plans to do this remotely using all these tools that are available. The program for 2021, because by the look of things, the coronavirus will still be with us up until probably even the early next year. So we have to review the data collection for 2021. And we also had to procure and develop and test our IT system to support this, because we really need to have a proper system that will able to support the new way of collecting data, and also update already established processes and procedures across our statistical value chain. One thing that we're also planning to do is to relocate and repurpose the resources, especially into this new environment. Let me make an example. Because of our fieldwork, our collection was basically face-to-face, meaning there was a lot of traveling, there's a lot of cars that need to be procured, and also issues around fuel. Now with the new way of collection, you don't need to travel a lot. That means that you have to now repurpose the other resources to other budget items like your airtime, your data. We also had to expand the use of alternative data sources and techniques to fill the data gaps. We've got also one of the strategies, one of the plans to see if maybe we could able to source telephone numbers from the external service providers to make sure that we bolster or we expand on the frame that we're having. The new philosophy concerning the human resources, we have to adjust, and in terms of how we are managing our field work, and also how we are monitoring productivity. Unlike before, where it was a face-to-face, now it's a remote data collection. It means that how you are managing your field staff. Communicate the proposed changes to both internal and external stakeholders. This is some of the activities that we are planning to do in the short and medium term. In terms of the long term, we will require us to review the entire statistical value chain. So our statistical value chain has to adapt or need to be adjusted to ensure that it meets the new mode of data collection that we are going to introduce. And we need to embrace the other data sources, e.g., for example, the admin data set. We also have to move into that particular space to see how we can actually mine into those particular admin data set. Establish a suitable frame to facilitate a multimodal data collection approach. Our census team are actually working on this to ensure that we are actually building this frame, which will help us in the future to be able to do the multimodal approach. But at the same time, also dealing with the issues of coverage, you know, the issues of telephone and how do you update it, how do you verify it, how do you maintain it. So this is some of the activities that as a SASAS organization will have to, or we are planning to go into make sure that we go into, in the next future, we're able to attend to these activities. This will offer household an opportunity to choose their preferred method of being enumerated. So here it will also, if you have this frame that is able to facilitate the multimodal data collection, it will give an opportunity for households to choose which mode they will prefer. And the other activity is to redesign the collection infrastructure and expand and repurpose the existing surveys. I mean, we've been talking about introducing what you call it a continuous population survey. This will also be one of the activities that in the near future that we want to introduce, where we're trying to consolidate all these surveys to introduce a one survey that is called a rotation, a modules that will be rotating on almost on an annual basis. In conclusion, considering the challenges experienced, we need to develop and define a frame for establishment of a multimodal approach for the household. The organizations have already initiated the process of developing this framework to establish a suitable frame to facilitate the multimodal data collection. We are currently redesigning and building our questionnaire, our system, our data collection method, our training, the publicity approach, and that will be aligned to integrated multimodal collection approach. We'll constantly communicate with our stakeholders to identify key needs indicators, and we'll continuously develop a statistical production infrastructure in line with the latest development of technology. So this is some of the thinking around how we envisage this new norm or the way of the new way of doing data collection. From the statistical organization. This is the end of my presentation. I think I will allow probably questions, if there are questions.
Wonderful. Thank you so much, Sally. That was a fantastic overview and really helpful to learn more about the plans on your side. I think if you turn off your screen sharing, Melinda will be able to, oh, here we go. Okay. So you should be able to see the questions that have been coming through on the screen. And certainly if anyone has any other questions, we can add them as well.
Okay. I think we would love to hear the thoughts on how to balance the risk. I think, Julia, your question, it's more of a difficult one to answer because the issue of trying to balance between the issue of getting a good data collection and the issue of the issue of availability of data. From our side, I think we went with the thinking that we should rather stop the data collection and rather go with the route of trying to introduce these new interim surveys, but knowing the risk in terms of what is brought in terms of not covering the entire surveys. So I mean the entire population. So yeah, for us, I mean we had to play those particular balance. The second one, when will the National Travel Survey result be released? The plan was to release it in October. And the reason why it was October is because October is the travel month. The transport month. However, because of already what I've said, chances is that we may not necessarily release the data in October. We'll probably release it in the following month, which is November. But I think, Tracy, I will keep you in touch in terms of when that will be released. I think the third one will status consider including disability as a. It's part of our questionnaire, the disability. I can even share with you, Kathy, in terms of how we are doing this. Yes, I think we can even take it offline. I can share it with you. My colleague Neil is actually also. I know from the GHS side, they are also looking at the issues around disabilities. The fourth one, I think, what sort of the length are you looking at for the CAWI when you're losing much content? Yes, Julia, us moving from the face-to-face collection, we have to reduce the questionnaire. And what we have done is that we have consulted with our stakeholders because we are going to trim our questionnaire. And we were thinking that we'll probably have a 20 to 25 minutes interview in terms of the telephone interview time. So we have to reduce it significantly. Any thoughts around ethics of using the previous collection contact information for recruitment? Yeah, we fortunately in this case, because we have to have a strategy in terms of how we're going to do this, we've looked into the data that we have collected before and see how we're going to conduct the interviews moving forward. And I think from our side, we are going through that process of coming up with a document that will actually deal with the issues around the ethics and how the approach is going to be in terms of utilizing the previous contact details. The issue of the SASQAF, yes, the framework will be, I'm hoping that my colleagues from Standard, they will able to update it, but that is the plan. We want to update it so that it can include the multimodal quality criteria into that particular framework. Let us say consider partner with external data collection agencies as part of, yes, like I said, the colleagues from SASAS, they're exploring to partner with external service providers to see how best can we improve our frame to include the telephone numbers and also to include other important variables that we can add into the frame. For example, the issues around the emails, which is something that my colleagues from SASAS, they are more interested in terms of the census that is due in 2021. Are you considering data fusion approach in your multimode? Yes, we are, and it's something that we as an organization will put it into our strategy in terms of how we're going to do this, especially considering that our surveys are big surveys with almost to 30,000 dwelling units. So we are considering that, yes. I think the last one I have undertook telephone interviews and online interview using the survey solution. Yes, we are using a survey solution as one of our KP solution to do this type of surveys. So we are happy so far with that solution. And internally, we are also trying to build our own solution to see if maybe in future we can also move to our own solution. I think, Julia, if I've missed some of these questions, I'm willing to probably provide a more in-depth answer in writing.
Absolutely. Thank you so much. That was really, really useful. I'm going to hand over to Tara now, who's going to help us wrap up.
Thank you, Julia. Thank you, Lebogang and Solly. That was absolutely fascinating. And You know, I think what's so important is to just get that balance right between the underlying principles of good research methodology, particularly around what is representativity, and on the other hand, just the practical logistical challenges. And that's not new. I mean, obviously, face-to-face surveying also has significant practical, logistical, and cost challenges. So there's always a trade-off. But I think what came out so well in all three presentations was that, you know, some of those trade-offs have shifted. Some have actually become easier, right? So there's suddenly no longer a major cost difference between interviewing someone in Gauteng and interviewing somebody in the distant Northern Cape, which should be a good thing, right? But on the other hand, you know, I'm looking forward either like now for some ideas, maybe also from participants and the speakers, but also in future sessions, for us to really get our heads around two things that have, you know, the underlying big changes. So one is this question about how do we think about representativity in a remote environment? And the second one is when we're doing remote surveying, what is the spatial element? Because when you're doing a house-to-house component, and those are obviously related to each other, that underlying principle of everyone has the same chance, an equal chance of being included in the sample, because everyone is assumed to be present in real life in a place. But if you're doing a remote sample, then everyone is not present equally on a phone, or certainly not online. So how do you overcome those fundamental barriers to the underlying concept of representativity? And then spatially, so again, if you're going house to house, even if you don't necessarily use it as an analysis form, or maybe only at provincial or national level, nonetheless, you have some record of where this person was. If you are phoning, or if you're speaking to that person online, unless you specifically collect that information, you don't know where they are. And that does present significant limitations for certain kinds of analysis, certain kinds of quality control, and certain kinds of sample distribution quality checking. So I think those would be really interesting additional questions to go deeper into based on what the excellent interventions that we've just had here. I think another thing that really came out importantly out of all three conversations was the importance of thinking through the profession of field researcher, data collector, and you know, the specific employment ethics around working with people in a crisis situation, obviously around safety, but also the effect that this has had on incomes and working conditions. So people's at-home working conditions versus in the field working conditions, etc. So, you know, large-scale data generating institutions as employers, I think is also a really interesting topic, which everybody touched on, which was great. And then a final thought is that what I'm hearing is that really the importance of panels. So panels have always been important because you get such richness out of longitudinal work. But they're fairly rarely comparatively used because they're just hard and costly, and you have to have a continuous funding flow, which is much harder than a once-off survey. But certainly if we've got a future where, you know, if we're not thinking of this particular period in time as a blip and then we go back to normal life, but if we think about it as a way of really fundamentally rethinking data collection, and in many countries, as we all know, there's been a complete shift to big data and away even from census, etc. So administrative data collection. We're not there yet by any stretch of the imagination in most African countries, certainly not in South Africa. And that's sort of your absolute panel, right? Because you've got data about everybody doing everything all the time. But in the meanwhile, while we're not there, do we need to rethink the underlying pros and cons and the balance of usefulness of panels versus once-off surveys, and much more move towards what SASAS is saying that they're already thinking about, is sort of continuous data collection through various panel platforms, and therefore possibly collaborative data collection, because at the moment we're still all doing our own things without so much sharing, or we share afterwards rather than before and during. So those are some comments and questions that I had. I'd really like to maybe have a final round of comments from the speakers around both the question of how to think about representativity as a random sample versus a segmented quota sample, and the question about the spatial element. If that's all right, Julia, if we have time. That's one last round.
Sure.
And obviously, if there are comments or questions about that from all the participants, that would be wonderful to have those in the chat as well. Maybe Lebo?
I think we may have lost Lebo, due to connectivity.
Oh dear. All right. Well, maybe let's go backwards then. Soli, is there anything you would like to add about the representativity and the spatial component?
I want to add something regarding the frame. I think that's why, as from our side, we want to spend time making sure that we build in this frame, because the surveys that we are doing are national. They have to be national representative. So the aim is to make sure that we improve the frame by just adding the element that I think Tara was referring to, the issue of getting now this additional information which about the household, and considering that the household, unlike the dwelling unit, which is more fixed and you know where the dwelling is, but the household is, because it is more moving around. We are trying, and I think with my colleagues from the methodology side, we're trying to make sure that we still, as much as we are collecting, because our sample, it's actually we are sampling the dwelling unit. We are not necessarily sampling the household. But then now, with the new way of collecting information, we really need to be careful to make sure that the representative principle are still intact while we are doing the mixed mode or the multimodal approach. So it is going to be a little bit of a challenge from our side, but then we're hoping that when we are done with updating our frame and also collecting this additional information about the household, we're hoping that when we do going through our test, our pilot, we will be able to have a much broader frame that can be utilized to give us a broader perspective about the South African population. Thanks.
Thank you. That's, I think, a really, really important point about moving from dwelling to household. I'm looking forward to some further reflections around that in other sessions. Can I go to Ben? And then I think Lebo's back. So Ben, what are your thoughts?
Yeah, thanks, Tara. Actually, the both points that you raised, the issue of representativity as well as the issue of spatiality, have been really the subject of really vigorous debate for those of us working on the online surveys. I think, for instance, the Moya Messenger, and it's something that Lebogang referred to, has real issues of coverage gaps. I mean, has a tendency to be slightly more urban focused and more youth based than the average national picture. So there were real concerns about, are we missing out older populations? Are we missing out more rural populations, and to what degree? So I mean, there wasn't a magic answer, to what do we do to move away from the non-probability to the probability sampling in a kind of lockdown kind of process, or less a working from home kind of process. But I think those kind of similar coverage gaps would apply to even the existing, I think you've alluded to them, the existing problems with telephonic listings and with online surveying generally. We have those issues. So we really look to the ongoing conversations with SASAS and their methodological developments there, and other institutions to really think through what are these new modes of interviewing that strive for better representativity than we sort of have had under the lockdown period for the most part. The spatiality has been even more really the subject of deep-seated debate, to the extent that the current UJ HSRC one's gone for kind of an overkill line of questioning on spatial variables, from asking about your local municipality, your ward number, your suburb name, your postal code, and your province, to the extent that actually it's been interesting to look at response rates to those questions, which have been really, really poor. People get very nervous about that level of disclosure about where they reside. So we found quite significant tapering off on those particular questions. Some of it's imperfect information. People don't know their ward number. People may not know their postal code universally, and also reticence to answer those kind of questions. I think it comes back to, and I think the other points you raised are equally important. Panels are expensive and difficult to maintain. We're not yet there with the admin data and the big shift towards that. I think it's about those steps towards it though, and that's kind of sharing. We're getting the culture is starting to develop that we need to be sharing more, harmonizing more with our measures, and making data more available. And I think that's where the new frontier is in the post-pandemic research environment.
Thank you, Ben. Yes, very helpful. Lebogang's back. Lebo, sorry about your load shedding. The question was, you know, in that kind of door-to-door way, the idea that you can randomly select, everybody has the same chance of being selected. Although, of course, there are time and space effects there as well, right? So if you're there during the day, you're not getting the working population, et cetera. And so in some ways, telephonic is better for that, because you can reach somebody wherever they are at any point in the day. But just some, you know, if you could say something about reflections around randomness. And then the second question was about how to capture or deal with the collection, the actual location, the spatial location of respondents when doing telephonic surveys. Lebo, are you there?
Yes, I'm here. Sorry, I keep getting kicked out because we're experiencing load shedding here and the connection gets affected by that. But I totally agree with what Ben was saying just now, that it's important to collect data on where people actually are. But I think one thing that we've been experiencing a lot is people just not being willing to tell you where it is they live, which makes it quite difficult to assess whether you've covered, at least spatially, where people are located. So finding methods around getting people to want to say where they are, I think that might be the first step, at least in saying how representative your sample is spatially. And yeah, I didn't hear the question, but I hope I did answer it.
Yes, no, thank you. That's great. Julia, I think we're close to the end of our time. And in fact, speaking of the CRAM survey, I think there's actually a briefing session starting at 12. And I imagine that a number of people on this call will be moving on to that call. I don't know. Can I just ask about, IP ranges? That's an interesting idea. I mean, obviously there's also kind of behind the scenes automated GPS coordinate taking, but then there's ethics around that as well, and it depends very much on the device of the person responding. And again, there it's if they're doing a self-completion survey more than if they're being phoned, I think. But we've got, I think, 7 minutes. So could I ask the three speakers to each just say one thing that they think currently the biggest challenge is for the future around methodology? What are we most struggling with that we don't have a good solution for yet? Sorry to jump that question on you, but if you can, if there's something on the top of your mind that you could share with us, that would be great. Lebo?
thinking.
Go ahead. Oh, you're fading in and out. Oh,
Anyone can hop in if.
Okay, Ben or Solly?
Yeah, I kind of wish I was
Okay.
load shedding with that question.
Okay. I think from my side, it will be a frame. If we have a geostatistical frame that can able to help us to deal with these multimodal modes, it will be great, because the frame that we're having, as I've already alluded to, is a frame that deals with the dwelling unit. Now, if you attach the household, which is the household frame, this for me, that is going to be a little bit of a challenge, because as I've already mentioned that we have to find systems in terms of how we're going to update this particular frame, whether it's from the telephone numbers or from the email addresses. So that for me, it's a big challenge that I'm hoping that with the colleagues who are here, we'll have posted this, we'll have more interaction in terms of how we can able to do this. Thank you.
Thank you, Solly. Ben?
I think in many respects it's along Solly's lines, pursuing that geostatistical frame. I think I share some of the comments Julia raised on the chat group, which is about the trade-offs. You know, for instance, if we move more towards CATI, you know, the ability to, for instance, do a household roster using CATI is really going to be a nightmare. So I think it's about thinking how on earth, you know, what are those trade-offs? I think it's the point you raised. What's deemed acceptable for different types of surveying that we want to do? And I think we don't have. I think that point that I raised earlier about the sharing and harmonizing, I think it's still very much an ideal. We're far from where we need to be. Looking across big survey outfits and say, you know, having available question data banks where we can see what can we draw on, what can we, you know, why ask a question, say, about trust or about solidarity or about the lived experience of a phenomenon differentially, when we could actually be fielding similar measures that allow us to do robustness checks and see where we're similar, where we're different, and use that as the basis for evidence-based tweaking to our methodologies.
Thank you, Ben. Lebo, can we give it one more try? Or else just type your comments in the box. Greatest challenge.
I hope you can hear me, but I think
yes.
I'm also thinking along. Along the lines of like selecting methods that actually work, and what weighting the different options timings with using either. I think that's one big question mark that we all have hanging there. And even in the selection of one method of doing things, there's always those trade-offs, as Ben called them, that will be involved in there. And how do we eliminate those moving forward?
Great, thank you very much. Thank you, everybody, for your excellent questions and comments. Thank you to the three speakers. Really looking forward to future sessions. Julia, back to you.
Great, thank you so much, Tara, and thanks to everybody who's presented and everyone who's popped up questions and everyone who's listened and engaged. It's been really fantastic having such a broad group here with us, and we're really looking forward to staying engaged with you in future. In the next couple of days, I will send through a link with details of how to access recordings and slides, as well as an agenda for the next session on the 28th of July, which will focus on ethics. And I hope you'll be able to join us then too. Any comments or suggestions on how to make these seminars even more useful would be also very much welcomed. Just pop me a message. Thank you so much and have a wonderful day.